Hello, friends. Welcome to everyone that has joined via Facebook. And I would also like to thank USB administration for inviting me to speak on this very important topic, also called as polycystic ovarian syndrome. Myself, Dr. Rakesh Hasbe, and I'm practicing gynecologist at Chiplun, which is based in Maharashtra, Ratnagiri district. So, as we all know, there are so many questions in young females' mind, especially what is PCOS, how does it occur, how do I know, or how do I identify whether I am a PCOS patient or not, can it be cured, and what are the risks that are associated with it. So I will try to address all these uh, questions that are in everybody's mind who are facing this particular problem in next 15 to 20 minutes. So let's start the discussion. So PCOS, also known as polycystic ovarian syndrome, is a condition of hormonal imbalance, right? So how to identify it? A patient with PCOS or polycystic ovarian syndrome will have two, three of the following symptoms. First and foremost, she will have irregular menses. The other one would be hyperandrogenic symptoms such as baldness or facial acne or excessive body hair growth, right? And the third one, the third criteria is the sonographical criteria, where your ovaries will have multiple follicles that are peripherally arranged, giving it a, bulky appearance, right? So any two out of these criterias are enough for diagnosing a woman for PCOS, right? So first and foremost, if you are having any of these criterias, you need to visit your gynecologist, and rest of the job will be taken care of by the with the help of the professional help, right? So what are polycystic ovaries? As I've already explained, polycystic ovaries are larger sized or bulky ovaries who are having multiple follicles which are peripherally arranged in typical ring like fashion, and these follicles are to be diagnosed on sonography. So polycystic ovaries per se is a sonographical diagnosis. You will visit your gynecologist with complaints such as irregular menses or excessive body hair growth or acne or male pattern baldness, right? And your gynecologist will advise some hormonal test or sonography, and on sonography there will be this diagnosis of polycystic ovaries, right? So polycystic ovarian syndrome affects almost one in every five women, right? So it makes the incidence as high as 20%, which is very high as compared to other feminine disorders, right? So 20% is a very significant incidence, and can it is not only restricted to adolescents or young females. It can also manifest in various age groups like adolescents, reproductive age group. Also in perimenopausal age group, it might have various sequels, right? So what is the etiology? Why PCOS occurs? This is very important to know, right? So first and foremost, it has some hereditary factor as well. It runs in families, right? If your mother is having PCOS, you are definitely a high risk patient for polycystic ovarian syndrome. Someone from your paternal side or maternal side, in your blood relation, if they are having irregular menses or other PCOS symptoms, then definitely you are also high risk or more prone for PCOS as compared to other females. Bad dietary choices. If you are not focusing well on your diet, if you are obese, if you are overweight as compared to the normal feminine age group or the control age group of your age, then definitely you are a high risk. So one should always think of having a good carb or a good diet, and exercise should also be a regular part of your lifestyle. Also, weakened immune system, accumulation of various toxins through your toxic routine or excessive stress, etc., can also make you prone for the PCOS. Right. So, what actually happens in PCOS? So, PCOS, the exact cause is unknown. Even after the development of the medicine branch, even after various sonographical and hormonal tests, we are not exactly able to identify what exactly causes PCOS, but there are few assumptions, right? There are several factors, including genetics, who are believed to make a particular person prone for PCOS. So the main underlying problem that occurs in PCOS is hormonal imbalance. In women with PCOS, the ovaries make male hormones more than normal. So there are always male hormones in smaller amounts in every female patient. But in PCOS patients, we see that the level of male hormones increases over a particular level, and which results in excessive body hair growth, acne, and also male pattern baldness. So high levels of these hormones affect the development and release of eggs during ovulation. So the main thing that you need to identify is the PCOS affects your ovulation. For a cycle to happen in a span of 28 days, the ovulation should happen at approximately 14th or 15th day of your cycle, and which gets affected during this particular disease, and hence your cycles are anovulatory. There are two types of cycles: ovulatory cycles, that means you're having cyclical bleeding, which is associated with the ovulation or rupture of your egg. But at the same time, in PCOS, the cycles are irregular and are not associated with ovulation, and hence are also called as anovulatory cycles. Right. So, what are the symptoms and signs of PCOS? First and foremost, the most commonly found symptom or the sign of presentation is of menstrual problems, right? Female will present mostly with irregular menses or complete absence of menses, right? Many of the times females are getting their menses delayed, right? Every 2 months, 3 months, they are getting their menses. But in severe cases or highly obese females, they do not even get menses, right? So these are the common symptoms. Dermatological features come after the menstrual disorders, such as I have already said, acne, facial hair, right, baldness, etc. And on sonography, as we have already seen, there can be multiple follicles making the ovaries grow in size and making them bulky. So, what are different health implications of PCOS? We have seen by now what is PCOS, what causes it, and what are the signs and symptoms. Now, let's see how it affects your system, right? So, increased risk of diabetes mellitus, which is the uncontrolled sugar levels, right? And hypertension is seen in such patients in later half of their lives, right? Increased cardiovascular risks are also seen in such patients, and also because of the PCOS and associated health problems, there are increased chances of increased risk with stress, anxiety, depression, etc. Right? So first and foremost, the weight reduction program is very important. You always should be fit at all points of time, right? Many of my patients I have seen, they have controlled their weight and they have really managed their PCOS well, because weight is very much the causative factor or has a major or huge role to play in PCOS. So gradual weight gain and obesity in approximately one half of women. So 50% of the times the weight is the only cause for PCOS, and hence you should work on your weight with a proper consultation. You can plan your diet, and you should also perform some regular exercises, right? So again, I would say that how PCOS is to be identified, right? Not everybody has an access to a gynecologist regular basis on a regular basis. So, how to identify? So, medical history by a gynecologist. What we see in OPD is we ask some questions like whether your periods are regular or not, whether you are having facial hair or not. Right? We tend to perform few physical examinations to see whether the patient is having obesity or not, whether she is having uh, uh, multiple acne, facial hair, or baldness or not, right? There are few blood tests that we perform, and again after that we advise some tests such as ultrasonography for diagnosis of PCOS. So PCOS is confirmed by irregular, infrequent, or no periods at all, which we call chronic amenorrhea, right? An increase in thick facial hair or acne and or blood showing increased levels of male hormones also is one of the diagnostic criteria for diagnosing PCOS. So along with that, an ultrasound scan, which is suggestive of polycystic etiology, is also necessary, right? So how PCOS is to be confirmed? Any two of these above three criterias are necessary. First, as I've said, irregular menses, right? The periods irregularity is one of the criteria. The other criteria is either clinical or laboratory identification of hyperandrogenism, which means increased male hormone levels, right? And the third and most important criteria is the sonographical criteria, right? So how to manage? Now, most important aspect of this PCOS is how to manage. So first and foremost, you should have a healthy lifestyle, right? So the healthy lifestyle means good diet, good exercise, and good mental status, right? So there are few lifestyle modifications, there are few medications that you should always take under the guidance of your gynecologist, and you should formulate some diet and exercise plan in after discussing with your physio or your gynecologist. So weight loss of even 5% is not much. You can easily decrease the weight loss or have a weight loss of 5% in a span of 2-3 months, right? So even that helps in improvement, significant improvement in PCOS. So what does exactly lifestyle modifications mean, right? So how to manage your diet? You should limit the processed foods, dairy products, and foods with added sugar, right? Adding more grain products, fruits, vegetables, lean meats to your diet is also found to be very effective. You should perform exercises regularly. Exercise means the cardio. You should focus more on the cardio rather than going for heavyweight lifting, because that is not what is going to help you reduce your weight. And if you're having any addiction such as smoking, alcohol, etc., you better should quit, right? So these particular lifestyle modifications will help you in lowering of the blood sugar levels. They will improve body's use of insulin. They will normalize hormone levels in the body, right? So how to manage our diet? So first and foremost, it is the most important part of lifestyle modifications. You should have a low carbohydrate diet, right? You should not absolutely shift towards a keto diet. You should have a low carbohydrate diet, right? You should choose complex carbohydrates which are rich in fiber, like whole grain bread, whole grain cereals, etc. You should have small but frequent meals. You should divide your meals in small but frequent meals, right? You should be aware of calories from liquids like soft drinks, milkshakes. I would advise you to get rid of these bad dietary habits such as soft drinks, dairy products, etc. The other part of lifestyle modification, as I've said, is exercise, right? So you should formulate a well planned strategy for decreasing your body weight. Do not opt for harmful diet plans such as ketos, right? And the recommended cardio exercise per day should not exceed beyond 40 to 60 minutes, right? Heavyweight training is not at all recommended at any point of time, right? So what are different benefits of exercise? How are you going to get benefited with exercise, right? uh, it will help you reduce your body weight, it will improve your self esteem, it will definitely regularize your periods, it will improve your mood and self esteem, a lower risk of developing diabetes and health heart problems are observed in patients who are opting for regular exercise or diet, right? Lower risk of uterine cancer is seen in such patients. So lifestyle modification should be followed up in your patient. A patient should be in a long follow-up with the doctor at all points of time. Every month or every alternate month, you should seek advice from your gynecologist. Your gynecologist will see whether you are on the right track or not, right? And along with that, as I have already said, the PCOS patients are more prone or at high risk for developing hypertension and diabetes in later half of their lives. So they should regularly check their blood pressures and sugars as well, right? So what are different medications? Now this part I'm just mentioning, you should all consult your gynecologist before opting for any sort of treatment. Do not just randomly start any medicines just by looking at some YouTube video or something, right? So there are multiple medicinal options that we have. First and foremost, there are two strategies that you should plan. Many of the PCOS patients are married and they're trying to conceive, so there are two, three strategies that you should follow. The important or the advisable strategy is to first regularize the periods and then go for fertility treatments. But if you are having PCOS of several years, then definitely you can think of fertility measures as well. So first and foremost, your gynecologist might advise you few birth control pills, right? So the importance of birth control pills here is that they will try to regularize your cycles. They will decrease the male hormone levels, and also there are few newer generation progesterones such as cyproterone acetate, etc. They will help decrease the facial acne or male hormone associated problems, right? So also, as we all know, the PCOS is a result of hyperinsulinemia, increased insulin levels. The diabetes incidence of diabetes in later half is high. So the insulin sensitizers such as metformin, etc., can be used effectively for controlling the symptoms of PCOS, right? So along with that, there are few medications which will help. We have already seen in our first or second slide that PCOS is a disease of unovulation. The ovulation doesn't take place, right? So there are few medications which are manufactured in a way that they will help you ovulate. But all these sorts of medicinal treatments are strictly to be taken under your gynecologist's help or advice, right? So the last insulin sensitizer after metformin I would mention, and I will finish this topic, are ionositols, right? So ionositols are a newer generation drugs that are being widely used for PCOS, right? They act as insulin sensitizers, same as that of metformin, right? Ionositols help balance chemicals that control blood sugar and fertility. They also have an effect on metabolism, right? The two ionositols to benefit in PCOS are myoinositol and D-chiro-inositol, right? Both are important to the body's response to insulin. Myoinositol also helps control hormones which are needed for egg production in the ovaries, and also D-chiro-inositol also helps control male hormone levels in females. So what is the take home message, right? Stop feeling ashamed of having PCOS. The incidence, as I have already said, is approximately 20%. There are many such females who are having similar complaints in the society. So stop feeling ashamed of having PCOS. Seek help as and when required. Always start your treatment under the guidance of a trained or qualified gynecologist. Stop feeling embarrassed, stop feeling depressed, and you should have a confidence or faith in your gynecologist that he or she may or surely will take you out of this PCOS. Work on yourself rather than just sitting at home and feeling ashamed of yourself. So I wish you all very I wish all the best for everyone that is watching this video. Just I would like to advise that keep motivated, keep working on yourself. And PCOS is a disease that we all together should fight, and is easily possible to get rid of the symptoms. So thank you.